and welcome to Standard Precautions and Beyond, the podcast series for the Alabama Regional Center for Infection Prevention and Control, Training and Technical Assistance. My name is Tessa Graham, and today we'll be discussing the Human Meta Pneumovirus, or HMPV. As we have seen in the news, in late 2024 and early 2025, Human Meta Pneumovirus has been a disease of interest, with reportedly high numbers of cases in a number of regions around the world, and recent reports even suggesting that cases are on the rise here in the United States. As flu season continues into the spring and we continue to deal with other winter respiratory illnesses such as RSV or COVID-19, it's important to understand the differences so we can protect ourselves and our loved ones from the Human Meta Pneumovirus, or HMPV. Joining us today is Dr. Rachael Lee. Dr. Lee earned her Bachelor of Science in Biology from Birmingham Southern College in 2006 and her Doctorate of Medicine from UAB in 2010, as well as her Master's of Science in Public Health from UAB in 2020. Dr. Lee joined the UAB Division of Infectious Diseases at UAB in 2016 and is currently an associate professor with the department, as well as UAB's Chief Healthcare Epidemiologist. In this role, she utilizes evidence-based medicine to prevent the spread of healthcare-associated infections, and her research focuses on multi-drug resistant pathogens as they relate to infection control. Thank you for joining us, Dr. Lee.
Thank you for having me.
Unfortunately, we're here to talk about another disease, but hopefully we can share some good information with everyone. But just to get us started, could you tell us about Human Meta Pneumovirus, or HMPV, just in general? What is it? How was it first discovered? Is this a new disease like we saw with COVID-19?
Yeah, I think we at least have a little bit of good news here. This is not a new disease. It was first diagnosed or first discovered in 2001, and it was identified in a pediatric patient who had similar symptoms to RSV. And so what they found was it's actually in the same family as RSV, and so as you would expect, it has very similar symptoms. So commonly we hear, all the things that we see with common colds. So fevers, cough, sore throat. And then what we see with RSV in younger kids, we can see what we call bronchiolitis. So kind of that spasm of your small bronchioles in your lungs that then can lead to kids having to go to the emergency department or even be hospitalized. Human Meta Pneumovirus is in a very similar family to RSV, so I think it's a little bit easier for us to understand what that is.
That makes sense for sure. So are those the typical symptoms of HMPV? Could you kind of go over those for us again?
Yeah, you cannot distinguish it from RSV, especially in young kids. So they have bronchitis, they may have pneumonia, bronchiolitis. Most people have fevers, cough, and then, if you're having that bronchiolitis, that can lead to lower oxygen levels, which then may have family members take you to the emergency department, etc. By far and away, this is extremely common in kids, and they've done prevalence studies that showed about 80 to 90% of kids under the age of 5 have already been infected with Human Meta Pneumovirus. It's just that unfortunately we get infected again and again. Our immunity is not as strong as we want it to be, and then we get exposed and get it again.
Oh, wow. Yeah, so it almost seems more like it's something we would call the common cold as opposed to something like the flu that has a little bit maybe more of a prevention area for it. So you've mentioned small children for sure being at risk of contracting it, but who all is at risk of contracting it? Is it more so some groups are more vulnerable versus others and we all contract it, or how does it usually spread through the population?
So I think we're all at risk for getting it, but the question is whether or not we get severe symptoms enough to have to go to the hospital. So you can kind of think of two spectrums, right? The really young and then people who are immunocompromised. So if you have lung disease like COPD, that may put you at risk for having difficulty breathing and you may have to go to the hospital. Or if you've had a stem cell transplant or lung transplant, you're immunocompromised in some sort of way, then we know that group of people are at higher risk of having more severe complications that maybe they go to the hospital. I'm an adult infectious disease doctor, and I've seen patients hospitalized with Human Meta Pneumovirus, so it's not uncommon, but it's more likely to happen in those people that are immunocompromised.
So when HMPV is transmitted, how easily does it spread from person to person? I know we hear with RSV, it can be very easy, especially in those settings with younger children, for them to spread it among each other. But is it easy for an adult to spread it to another person? Kind of how is that transmission? How long is someone contagious and could spread it as well?
Yeah, that's a great question. So HMPV, or Human Meta Pneumovirus, is very similar to the common cold. So it is spread through large droplets. So if you are coughing and sneezing, and you're within 6 feet to someone who's coughing and sneezing, you are at risk for getting infected. We typically say that if you have symptoms or fevers, you're probably infectious, and that's one of the reasons why what we apply to everything from COVID to flu to RSV, it's applicable here as well. Stay home if you're not feeling well, wash your hands frequently. All of those make a lot of sense because of how that virus is transmitted. So we do see it in a lot of younger kids, and so kids play closely with one another, they share toys, and so you can also see that kind of contact transmission. So transmission, if someone is coughing and then they touch a toy and then they hand the toy over to another child, then that can lead to spread as well. What we typically see is, if you've been exposed, it takes about 3 to 5 days before you start showing symptoms. So it's all in line with all these other respiratory viruses that we see.
So with most recent news, we're seeing it kind of overlap with RSV and flu and that really intense common cold season we go through with the winter time. But is there a particular time of year when human metapneumovirus infections tend to peak? Is it now? Is it seen throughout the year, and maybe it's more of a reporting feature that we're hearing more about it now?
Yeah, so it is typically January through March. I think one of the reasons that we're hearing about it now is that, at least from my understanding, that China has revamped their process for notification for respiratory viruses. And so because they have a more robust system, every positive test for metapneumovirus was being detected and then notified. And so then everyone saw these numbers, and so they said, whoa, what is this? But it is typically seen kind of in the winter respiratory season.
Gotcha. That makes sense. So it is common now, but if we're looking specifically for something, we're definitely going to see a little bit more of it than maybe we typically would.
Right, exactly. I think that's the power of having a robust surveillance system, right? So we want to make sure that we are aware of what's going around so that then we can help everyone understand that and then know how to protect themselves.
So how is human metapneumovirus typically diagnosed? Could you kind of go over that for us again? You mentioned their robust screening programs in China. Do we have anything similar here? There are specific tests that you can kind of ask for?
Yeah, so typically this is detected in a respiratory virus panel. So it's a PCR test. So if you think about COVID and flu, we have the over-the-counter COVID tests. Those are antigen tests. We also have, flu tests that can be done in the clinic. That's also an antigen test. And then we have a whole bunch of PCR tests, but a lot of times this is bundled in our viral respiratory panel. So if you think about yourself, say you have symptoms of cold and flu and you test yourself for COVID and that's negative, and then your symptoms kind of get better, you may miss your window of diagnosing human metapneumovirus, which may also explain why we're not seeing as many cases diagnosed here as, say, in China.
So are typically people, once they've been diagnosed and they go into that kind of treatment phase, is there a specific treatment, a specific antibiotic or anything available for it?
Unfortunately, no. They've tried to look at similar things to what we looked at with COVID. So there's an antiviral medicine called ribavirin, and that didn't work very well. And they've looked at monoclonal antibodies like we did with COVID, and that didn't work very well. So unfortunately, right now, all that we have is supportive care. So, taking care of your fever, making sure you have enough fluids. If you get into the hospital, we'll, make sure you're breathing okay, and we'll give you medications to kind of help prevent wheezing. Those unfortunately are the biggest things that we have, which is one of the reasons why we want to do our best to try to prevent that spread as much as we can.
That makes sense. So definitely everyone out there will want to stick to taking their vitamins, eating well, exercising, drinking plenty of fluid so that they can stay healthy to fight it off as well. Which,
Right.
adding to that, I know with flu and with COVID-19 as well, we have vaccines. With RSV, we have a vaccine as well that children, or I believe the elderly, can get as well. I'm assuming there's not a vaccine here.
There are unfortunately no vaccines. They've been working on vaccines in different animal models, but nothing that has really shown to make it long lasting like we would want it to. So that's why it hasn't really gone anywhere with it.
So one thing that people always ask about now, with everyone's so aware of long COVID and those types of conditions, are there any kind of lasting health implications for someone that would have contracted HMPV?
So typically I would say no. There are studies in RSV in kids that may lead to kind of more childhood asthma after they've had exposure to RSV. I don't know if they've seen that in a similar way with human Meta Pneumovirus, but it is in the same family and it can cause the same symptoms. So I would expect that you could see kind of those long-term effects, which is really more like damage to the little bronchioles in your lung. But from a long COVID standpoint, or if we wanted to call it long human Meta Pneumovirus, I don't think we've seen that. I think it's more along the sequela right after you've been infected and dealing more along the lines of potential scarring, etc.
Gotcha. So kind of maybe those symptoms will hopefully be the brunt of it if you happen to contract it. So We've kind of hinted at some transmission. What are some prevention measures that people could take, particularly in community or group settings such as schools, long-term care facilities, even shelters? Especially during the winter, we see a lot more of those warming shelters and things for people. What are some effective common preventive measures?
Yeah, I like to think of it as what can I do to help others? So if I'm feeling sick, if I'm having kind of a cough or not feeling well, stay home. I mean, I know it's easier said than done, right? We are a very big kind of working group of people, and so telling people to stay home and rest is really difficult. But if you're not feeling well, stay home. Or maybe you've got a little bit of a cough and you think that it could be your seasonal allergies, but it's this period of time, it's okay to wear a mask, because we know that wearing a mask when you're sick is actually probably the best data for preventing transmission. And the other piece that you can do is what can I do to protect myself? So hand washing by far and away. You touch a lot of things in the wintertime that could be contaminated with different viruses. So washing your hands frequently. If you try to kind of steer clear of like large group settings, maybe where people are coughing a lot. And then you also can wear a mask as well. So that helps protect you from any potential people that could be coughing around you, etc.
All things that we hopefully learned a little bit about during COVID and can hopefully pick up and help protect ourselves with.
Exactly.
But thank you so much for that, Dr. Lee. So as we'll wrap up here, so thank you for sharing your time with us. Are there any further resources you'd like to recommend to people about HMPV, or any final thoughts you'd like to leave with them?
Yeah, I think, so the CDC does have a good website about human Meta Pneumovirus. It's cdc.gov/human-Meta Pneumovirus. So if you know how to spell Meta Pneumovirus, then you can find it there. But the WHO has also some good information about it too. So if you have any more questions, those are my kind of go-to places for understanding what it is and what to look out for.
Thank you, Dr. Lee, and we'll share those as well when we publicize the podcast so that people can find those links and those resources easily. But thank you so much for joining us, Dr. Lee. We always appreciate your expertise and being available to meet and share your knowledge with us.
Well, thank you for having me.
Thank you. And thank you, everybody, for tuning in to Standard Precautions and Beyond, the podcast for the Alabama Regional Center for Infection Prevention Control, Training, and Technical Assistance. And join us for the next one.